Ladies and gentlemen, we're very much keeping up the momentum here at M42 at the main stage. There is no time for any breaks because we have back-to-back thought-provoking panel discussions, and we're going to be going straight into looking at ESG in healthcare, a prescription for a healthier planet and society. I'm going to be inviting the next lot of speakers on stage. Please do make your way to stage and sit under your appropriately titled places. Amy Leigh-Hoxkey, who's the Director ESG G42, Ahmed Ashur, the Chief Sustainability Commercial Officer, the Middle East and Africa Microsoft, and Elihan Arol, who's the Global Portfolio Manager for Healthcare Vertical Market, Siemens. And I'll be handing over the mic, literally, to Sarah Barada, who's a Healthcare and Life Sciences Lead Middle East, Roland Berger. We know her from COP28. Give them a big round of applause.
All right. Thanks everyone for joining us for this another wonderful session on ESG. And apologies for my weird voice. Just gone down with something over the weekend. Thank you for M42 for inviting me to moderate another panel on such a critical and important topic, which is ESG and climate change on a broader term. We're going to start probably by just quickly saying that in the last COP28 session and the conference, there was a lot of conversations on the impact of climate change on healthcare in general, whether it's on healthcare cost, on pre-mortality and rise in morbidity and other indirect and direct impact of climate change on healthcare. But today we want to focus specifically on the role of the healthcare providers and the healthcare industry in reducing their contribution to the global emissions. So I'll start first. Welcome to my panelists for today. A question for all of you is, what do you see as the key barriers and opportunities for the healthcare system to take on ESG initiatives?
Okay, I think you can hear me right now. Maybe I can start.
Yes.
So first of all, it's really nice to be here. Thank you very much for M42 for hosting it. And it's an amazing crowd here, so thank you very much for listening us as well. So when we look at the especially ESG topic and the barriers and the opportunities, what we see is that the challenges in the healthcare industry is pretty much the barriers, but also brings opportunities for the ESG initiatives as well. When we are talking about challenges in the healthcare industry or the healthcare sector, you see, first of all, staff shortages. Based on the World Health Organization, it is going to be more than 10 million staff shortage, medical experts will be needed in 2030. So it's a big challenge. And on top of it, patient expectations are rising every day. And on top of it, we have cost pressure, plus demographic changes. I mean, you name it. It's like a perfect storm. In order to be able to manage this, you need ESG initiatives, but also there are the barriers to implement these initiatives. So then what is the answer? What we see is, especially in Siemens' biggest enabler in terms of this situation is digitalization, digital transformation, and digital technologies to be harnessed effectively in this area. In order to do that, of course, it brings some complexity when you first hear it as a healthcare provider, but then you need ecosystem partners, technology developers, you need an domain know-how and technology know-how, you need to combine them together.
We'll delve into the technology and the partnership aspects as well, but I want to hear also from Ahmed, what's your views on the first question?
Thank you, and I'm happy to be here also with you. So yeah, I think, looking at all other industries, the healthcare has been one of the industries that maybe is a bit behind when it comes to adoption of ESG. And maybe one of the reasons I would see that is it's not really one of the key missions of the healthcare industry. And it has been always perceived as more of a burden to be able to report on an ESG information as opposed to seeing it as an opportunity. So recently we're starting to see a lot of innovation when it comes to how do I look at ESG as actually an enabler for my strategy. A lot of very innovative CFOs now, they look at ESG as better way to actually judge the performance of any organization. So definitely the opportunity is changing the mindset of how I look at ESG projects instead of looking at it as a burden of a reporting and so on, but actually as an opportunity of how can I look at my organization performance in a different way.
Thank you, Ahmed. Amy?
So further to that, we know that there's actually a lot of misunderstanding and lack of knowledge in terms of understanding the climate health nexus. So the alarming statistics we know, 13 million people dying of climate-related illnesses each year. And on the flip side, if healthcare was a country, it would be the 5th largest emitter in the world. And this is where we focus on looking at the important point of fewer patients means fewer emissions. So shining a light on our carbon footprint and actively engaging with outcomes-based partnerships, such as the partnerships with Siemens, to reduce the carbon footprint of our operations.
Thank you, Amy. Yes, we don't typically think about the healthcare industry as one of the biggest contributors. We always think about oil and fossil fuel and lots of other industries, but definitely the healthcare industry has a very important, mission, both on saving lives and on the prevention and treatment side, but also on taking steps to decarbonize facilities and operations. Going back, Alihan, to the point around technology, can you give us a few examples on technology solutions that you believe can help decarbonize healthcare facilities?
Sure, I would be happy to. So, when you're talking about decarbonization, especially through Siemens, what we do is basically looking at it from a 360 approach. So, starting from the consultancy even, so where we are first setting up the KPIs for our customers, but then the design phase, planning and design, then implementing and operation and services, and finally coming to monitoring the success. And in this kind of a life cycle approach, then you can really address the, let's say, journey of decarbonization to net zero. Maybe an example from Denmark Vitro Hospital, where we did all these aspects, starting from the consultancy phase, ending up with the success monitoring, and the outcomes was really nice. So we had the chance to lower the energy consumption around 30%, but in scope, imagine that we are also using some on-site energy production like PVs or wind turbines, changing some of the HVAC equipment which are old and which are not efficient, or also enhancing automation and using the AI to even enhance the offerings that we have, create on top of use cases and so on. Then you can bring really value to the customer, and 30% energy efficiency, you can achieve that.
It's a great KPI there, which means that you can see the results and measure these results based on the ESG initiatives. You mentioned AI in your answer, so I'm going to move to Ahmed to ask you what Microsoft is working on to harness big data analytics and AI in the area of reporting, ESG, and initiatives around this.
Yeah, so we have our own sustainability journey. If I would say Microsoft as a global company, our own emissions represents 0.03 of the total planet emissions, which is that's a significant amount. So we actually represent 0.03. So for the last 20 years, we've embarked on a mission of, by 2030, we want to be carbon negative, water positive, and a zero waste company. And we're taking it even a step further, which is by 2050, we want to remove as much carbon from the planet as much as we've produced since the inception of Microsoft. So that team is a very comprehensive team that has been working for the last maybe 20 years on this mission. We publish a regular sustainability report publicly that shows all the innovation and the details of what we've been learning, how are we tracking our progress towards that commitment. But ideally, what we did is we went and we sat with this team and we said, if we would develop one technology that can help companies, then other 99%, how can we help them embark on the same journey? What would be one challenge that if we fix can actually help all these companies? And the answer was data. The biggest challenge when it comes to sustainability and ESG is there's a massive amount of silos of data that is really valuable, but it's very difficult to actually go through. And to your point, when it comes to generative AI, that's where it really comes and helps, because all this massive amount of data, that's very difficult that we can actually go and process. So by leveraging generative AI, we're developing what we call the Microsoft Cloud for Sustainability, harnessing the power of AI to help you actually be able to pinpoint challenges, opportunities, where do I really need to go and do more efforts in reduction, as well as partnering with all our partners, of course, like Siemens and M42, to make sure that we're embedding these systems with the valuable data.
Thank you, Ahmed. Speaking of partnerships and M42, I move on to Amy to ask you to talk to the audience a little bit about what M42 is doing in terms of both looking at technology solutions, but also some creative partnerships to address the climate health nexus.
Indeed. So the road to net zero can be a lonely one. And this is where we engage in our active outcomes-based partnerships. One example is, I know there's a few people from the Environmental Sciences Department here, so I hope they're listening, is a partnership with OceanX. So going out and gathering large amounts of environmental genomic information and using AI predictive modelling with this big data to form insights to understand the current condition of our oceans. Now, why is this important? We know that through climate change, changes in weather systems, such as increased temperatures and precipitation, is resulting in new diseases spreading up in new geographic locations. So by using this information, we're able to proactively put in place systems and measures to minimise impacts on these communities, particularly those most at risk and vulnerable. Similarly, on our human genomics program, so our Emirati genomics program, which we've been doing in partnership with Department of Health, again, we're gathering data to have a more informed understanding over the community health and putting in place proactive solutions to minimise impacts on these different user groups. And importantly, on the decarbonisation front, drivers for change in the ESG side of things has three key areas. One is obviously regulation. The second is looking at incentives, such as financial incentives, award programs. And thirdly, and importantly, is looking at training capacity building. So last week, the Department of Health invited us to a workshop where they built our knowledge in terms of understanding what systems and solutions are available to decarbonise our assets and infrastructure through the retrofitting of some of our existing facilities. Now, this obviously makes sense because it works from a carbon perspective and it importantly works from a cost perspective. Having more efficient infrastructure and assets obviously reduces the utility bill. So, very interesting.
Amy, just maybe a thought now. A lot of the hospitals and groups do not know where to start, and they often fear that it'll take long to achieve and see these results. What's your view on how long actually does it take to start an ESG initiative, and how long does it take to actually start measuring and seeing this impact in real life? Maybe from your experience, Alihan.
Sure. Maybe I can, approach to it from a decarbonization point of view. Especially, for example, in the last COP28, we signed an MOU with M42 and Siemens together to start collaborating around decarbonization and starting from the advisory. So setting up a strategy together. What are the KPIs we should be focusing on and that way. And then going to the planning and design phase where we go to the sites of actual hospitals, right? And where we check out if what are the opportunities and so on. And then finally we come to the implementation because now we know what to do, in which site, how to implement the energy efficiency and decarbonization measures. And then we implement them and we give on top of it services. It could be digital services, it could be in the operations, making it steady in terms of the energy efficiency and so on, and then success monitoring. If you look at it in this life cycle, it takes about a year to really implement all these effects and then monitor the success, if we achieved our KPIs or not, from maybe a hospital point of view.
Ahmed, you mentioned the great work that Microsoft is doing to decarbonize itself. Do you see any parallels in terms of lessons learned from your experience that can be actually shared with the healthcare industry? We're having a technical...
Yes, no worries.
Oh, there you go.
So, yeah, definitely. I think, as I said, we've been embarking on this journey for the last 2 years on how can we really help other organizations across the globe jump on this sustainability journey in a much easier way. So today we're offering the Microsoft Sustainability Manager, which is a tool that you can currently download and actually start connecting all your existing systems to measure your carbon footprint. So it has all the standards globally. It currently leverages scope 1, 2, 3 from a carbon point of view. It also has water and waste and biodiversity. So that's a very easy step to start with. I'm not saying it's an easy journey, of course, because the data points and having to work with all the other organizations that has these data points is a journey also. The other angle is also when we look at cloud computing, so your carbon footprint from IT is a significant part. Just by moving to cloud, you actually reduce 80% from the on-prem emissions. So that's another easy way also to start moving workloads to cloud as opposed to on-prem. The good thing is also from our cloud computing, whenever you're hosting your services on Microsoft Cloud, you get free of charge an emission dashboard. So you will get reports on monthly basis on all the emissions that you can actually plug into your sustainability manager, and then it becomes part of your ESG reporting. But yeah, at the end, I think when you look at any ESG project, it has to be broken into small steps, because if you try to address the whole thing at once, it's definitely a very large project. So it's always good to start step by step. You put a mission that I want to cover scope 1 for this year, and then I build scope 2, and then so on. But the best thing is you just need to start somewhere.
Great insights. Thank you, Ahmed. Typically, when you think about ESG initiatives and healthcare facilities, we think infrastructure, buildings, use of energy, emissions, probably waste management as another one. But we don't think a lot about the footprint of the workforce and the patients going to and from these facilities. And this is something that you and I, Amy, discussed over our prep call. I'd like to hear your point of view on how prevention can also be an initiative that helps reduce carbon emissions by healthcare facilities.
Indeed. So fewer emissions, fewer patients means fewer emissions. So how can we deploy technology to avoid people even getting in the car and driving to the hospital to begin with? So through the devices such as M42, so you might see some cards around here, which essentially the audience can download this application, go in, ask the question, get a high quality response, and therefore avoiding you even to need to go to the facilities in the first place. And ironically, we know that people often get sicker when they're in hospitals. And I just wanted to raise the point in terms of one of your first questions was, in order for us to figure out where to start, it's a mammoth task and it can be overwhelming. But by understanding what the risks are and the opportunities are by doing something like a robust materiality assessment, it enables us to form what our roadmap will look at, where we can start our efforts, what's the low-hanging fruit, directly responding to what our shareholders and stakeholders are looking at. And we know globally, greenhouse gas emissions at the top of the agenda, so let's start with that.
Thank you, Amy. I think Alihan, you had something to add?
Yeah, especially I have maybe wanting to make it much more concrete, a direct solution. How can we really decrease decarbonization in a healthcare environment? This is something, let's say, right now we are cooking. Okay, the initial studies we did in US, this is called green radiology, because when we look at the hospitals, what we see is that the radiology department consumes it from 4 to 8% of the total energy in a healthcare environment in a hospital. And when we look at the MRIs are the biggest energy consumer in radiology departments. And so what we did is basically we combined our know-how from Healthineers, which delivers the MRIs, and from the smart infrastructure organization Siemens, which delivers the monitoring capabilities of energy, and we combine them together. And what we understand is that especially we are not that much using MRIs efficiently in terms of staff point of view, in terms of energy consumption point of view. So we find a package that we can really increase the efficiency on EMRs, like more than 30%, by combining a monitoring of the energy and the usage of the MRI, and then also suggest how to use MRI more efficiently to the operators. So helping operators to use it, and also somehow eliminating any waste of energy during for example, weekends or holidays and so on. This is something that we are really developing newly right now in combination with Healthineers and basically bringing all the know-how and also customer know-how as well.
That's a great point. You mentioned waste. So we often think about waste as disposables and whatnot, but there's a lot of energy that's being wasted through unnecessary equipment, extra MRIs and whatnot. So that's also a very, very important point. Amy, I want to go back to the point you were talking about incentives, and the regulatory environment is quite important. I would say to push, more like motivate healthcare providers to actually get on their ESG initiatives. I want to get your point of view on, especially in the region with Department of Health in Abu Dhabi and the Ministry of Health. How do you see that motivating providers to start?
Hello. Sorry. Yes, it's interesting. So it's looking at the established regulators, such as the Department of Municipality and Transport, where they already have this very well-known Estadama document, and that's primarily driven to all sectors in the built environment. But you can see some really, really fast-moving new policies and documents coming out. So the Emerald Index is something that the Department of Health has just introduced, and that's something we're actively partnering with the Department of Health to look at, again, our carbon footprint, where we're at, and what measures we can take with existing partners, government and non-government, to reduce our carbon footprint.
Thank you, Amy. I want to open the floor to questions from the audience, if anyone would like to ask our panelists. Go ahead, Lemin.
Hello, good afternoon. Senior Advisor Ronald Berger. Thanks a lot for very interesting insights from the panel. One of the questions I wanted to focus on was the G part of ESG. So it's very interesting that you shared a lot of stuff about what you're all doing in terms of collecting data. But I think the G part in terms of governance, like trying to convince your staff and staff in hospitals that this is something that really matters to them. Because one of the challenges to do with climate change relates to people think, oh, 2050, 2060 is too far. It's not going to affect me. It's not going to affect my children. So what's the incentive for me to do something about that now? So I'd like to hear from someone on the panel about what are they actually trying to do to convince their staff that this is really important. Thank you.
So excellent question, thank you. I'll be quick. What was very interesting over the last end of last year, moving into COP28, to help inform our approach, we undertook a robust ESG survey. So that was given to the staff to understand, we want to hear from you what's important. And the response was overwhelmingly positive in terms of we really care about the environment. So we are hearing from them, and there was a 98% success rate in terms of their response. So I actually don't know if it's a convincing mechanism, but your point on governance is really important. And it's been recognised by the Ministry of Climate Change and Environment. So all those entities that signed into the Net Zero Pledge last year, they don't want to, the ministry don't want to know the plans, they don't want to know the inventory yet. What they want to know is the governance that's put in place. What are the systems, people, procedures that you're going to put in place to create your inventory and your transition plan?
Any other questions from the audience? We have time for one more. Go ahead, yes, of course.
If there's no other question coming up, maybe an answer from my side to this question. So what we see is, especially the, let's say, the solutions we implement, they don't just, create energy efficiency, but also staff efficiency. And for example, just an example, okay? According to the studies, a nurse spends 72 minutes just to find an asset, to be able to use it for a care. If you apply a solution that enables this, so that they can find the necessary equipment very fast, so they have this more or less 1 hour more to take care of their patients, which they are passionate for. So, but this also creates energy efficiency, this also creates a cost efficiency, so you save money, but on the other side, you help your staff to their job much more easy, and they have also doesn't need to take care of lots of things that they are doing maybe on paper right now, or maybe doing it manual right now, and so on. So the ESG initiatives that you apply have more than one benefit most of the time. And if you show these to your staff, then they will see how valuable it is also for themselves. So they have also a huge part in it. with the solutions as well.
Thank you, Alihan. Any other questions from the audience? If not, then I'm going to ask each and every one of you to give me a closing statement on the successful prescription for ESG and the healthcare facilities. Starting with, who wants to go? Ahmed.
No, I think
Volunteered.
I think the conclusion of many of the discussions we've had today is it's essential to start somewhere. We know it's a complex journey, and it has a lot of change and change management across. But there is so much data already existing from your building management system, from your current electricity purchases, bills. So there is a baseline of data that you already have, that you don't need to do much to generate. So just start with that so that you can at least start accounting for your existing data points, and then at least you've started somewhere and you can start seeing where do you stand from a full ESG picture.
Thank you, Ahmed. Amy?
Bottom line, fewer patients means fewer emissions. So prevention is the key. Secondly, and importantly, outcomes-based partnerships. So it's great to join the panel with these gentlemen today who we've already got existing partnerships for. And that's massively going to help on our ESG journey, importantly, our decarbonisation to a low-carbon future.
Thank you, Amy. Alihan, finally.
Maybe finally from my side, I think Amy also put it really nice. So it starts always with a commitment, okay, for companies. So M42 shows it, right? Having this here a panel, and also Amy also mentioned a couple of times. And then second is ecosystem. You create it, like with Microsoft here, with Siemens here, so that you can apply it. And third and the foremost is you do it in a life cycle approach. Nothing ends, nothing finishes. You always start and try to do it better and better every day, but with a plan, with a commitment, and with your ecosystem partners.
Thank you, Alihan, and thank you for the panelists, and thanks everyone for listening.